He thought it was just indigestion from his wife's spicy lasagna, but when I saw his test results, I knew he had less than an hour to save his life. The scariest part? He had zero classic chest pain symptoms. I'm Dr. John, and this is Healthy Aging Daily, where I share real-life medical stories to help you and your loved ones live healthier every day. If you care about aging well, consider subscribing, and now let's dive into today's story. Robert was 68 years old when he came into my office last winter, a retired high school principal with an active lifestyle, at least that's what he claimed. In reality, retirement had changed his routines dramatically. His daily walks to and from school had been replaced by morning news and coffee on the couch. The stress of managing hundreds of teenagers was gone, but so was much of his physical activity. "Doc, I've just been feeling off," he told me, shifting uncomfortably in his chair. "My wife made me come in, says I've been more tired than usual, and she noticed I get winded bringing in groceries." Robert wasn't particularly concerned. He attributed his fatigue to age. "I'm pushing 70, what do you expect?" And the slight discomfort in his upper abdomen to his wife's cooking. "She's been experimenting with spices since we got that cooking subscription," he joked with a weak smile. But something about his presentation concerned me. His color was off, slightly ashen, and when I asked him to rate his energy compared to 6 months ago, he paused and admitted it had dropped significantly. "Maybe a 5 out of 10 now, used to be an 8, he said. The most telling part? He mentioned casually that he'd started taking afternoon naps for the first time in his life. Never needed them before, not even when I was dealing with budget cuts and teenage drama all day. I started with the basics: blood pressure, heart rate, oxygen saturation. His blood pressure was elevated at 165/95, significantly higher than his usual readings. His heart rate was slightly elevated at 88 beats per minute, and when I placed my stethoscope on his chest, I detected an irregular rhythm. Robert, how long have you been having the fatigue and this discomfort?" I asked. "About 3 weeks, maybe a month. It comes and goes. Some days I feel fine." When I asked if he ever felt short of breath, he hesitated. "Sometimes when I'm carrying laundry upstairs, but that's normal at my age, right?" "No, it's not normal at any age." I ordered an ECG immediately, followed by blood work to check his cardiac enzymes. While waiting for results, I considered several possibilities: angina, silent myocardial ischemia, heart failure, or even just acid reflux with deconditioning from his more sedentary lifestyle. The ECG showed ST segment depression in several leads, a sign of reduced blood flow to the heart muscle. His troponin levels came back elevated, indicating heart muscle damage. This wasn't just fatigue or indigestion. Robert was actively having what we call a silent heart attack, or NSTEMI, non-ST elevation myocardial infarction. I immediately called for an ambulance and explained the situation to Robert and his wife, who had joined us by then. "But I don't have any chest pain," he protested, looking genuinely confused. "Isn't that what a heart attack feels like? The dramatic clutching of the chest they show on TV?" "Not always," I explained, "especially not in older adults." So what exactly was going on with this patient? Robert was experiencing what we call a silent heart attack, a myocardial infarction with atypical symptoms. Many people, especially those over 65, don't experience the classic crushing chest pain we associate with heart attacks. Instead, they might feel fatigue, shortness of breath, discomfort in the upper abdomen, or simply feel not right. The mechanism is the same as a typical heart attack. A blockage in one or more coronary arteries reduces blood flow to the heart muscle. This restricted blood flow means less oxygen reaches the heart, causing damage to the heart tissue. But the way the body interprets and signals this damage can vary tremendously, especially as we age. Why does this happen? As we get older, changes in our nervous system can affect how we perceive pain. Additionally, some people, particularly those with diabetes, develop neuropathy that can mask pain signals. In Robert's case, his body was sending warning signals: fatigue, shortness of breath, vague discomfort, but they weren't the dramatic symptoms most people expect. About 45% of all heart attacks are considered silent or present with atypical symptoms. And here's the concerning part: these silent heart attacks can be just as damaging as the obvious ones. But because people delay seeking help, the outcomes are often worse. Risk factors include being over 65, having diabetes, being female, yes, women are more likely to have atypical symptoms, or having had previous heart issues. Robert's risk factors included his age and, as we later discovered, untreated high blood pressure that had developed since retirement. This condition is more common than we think, especially as we age. Robert was immediately transferred to the cardiac unit where an angiogram revealed a 90% blockage in one of his major coronary arteries. He underwent an emergency procedure to place a stent, opening the blocked artery and restoring blood flow to his heart. Over the next few days, we established a treatment plan that included daily medications to control blood pressure and prevent clotting, a structured cardiac rehabilitation program, dietary changes focusing on reducing sodium and increasing heart-healthy foods, and a gradual return to regular physical activity. When Robert came for his follow-up 6 weeks later, he looked like a different man. The color had returned to his face and his energy levels were improving. I had no idea how bad I was feeling until I started feeling better, he admitted. But the most valuable part of Robert's story is what we can all learn from it. Here's what I recommend to all my patients over 65. First, know the atypical signs of heart attacks: fatigue that's new or worse than usual, shortness of breath with mild exertion, discomfort in your jaw, neck, back, or upper abdomen, nausea, lightheadedness, or just feeling off for no apparent reason. Don't dismiss these symptoms as simply getting older. Second, maintain consistent health habits. Robert's transition to retirement had eliminated much of his daily activity. Our bodies need regular movement. Aim for at least 30 minutes of walking or similar activity daily. This helps your heart stay strong and efficient. Third, monitor your blood pressure regularly. Many of my patients are surprised to learn that blood pressure can increase significantly after retirement, partially due to lifestyle changes. Purchase a home blood pressure monitor and check twice weekly, keeping records to share with your doctor. Fourth, stay hydrated. Many seniors reduce their fluid intake to avoid frequent bathroom trips, but dehydration makes your blood thicker and forces your heart to work harder. Aim for 6 to 8 glasses of water daily. Fifth, never ignore changes in your energy level or exercise tolerance. If activities that were once easy become difficult, that's a red flag worth investigating. And finally, maintain regular checkups with your doctor. Robert hadn't had a proper physical in nearly 2 years, which might have caught his rising blood pressure earlier. Robert's story reminds us that heart attacks don't always announce themselves dramatically. Sometimes they whisper. And in the noise of daily life, especially as we adjust to major life changes like retirement, we might miss these crucial signals. The key takeaway is this: know your body's baseline and take any persistent change seriously, particularly as you age. The symptoms that saved Robert's life weren't dramatic, but recognizing them made all the difference. Have you or someone you know experienced unusual symptoms that turned out to be heart-related? Share in the comments below. Your story might help someone else recognize these critical warning signs. If you found today's medical story valuable, please consider liking this video and subscribing to Healthy Aging Daily. Each week, we explore real cases that can help you navigate the unique health challenges that come with aging. Staying healthy as we age isn't always simple, but understanding what's happening is the first step. See you in the next episode of Healthy Aging Daily. For those who want to take immediate action to protect their heart health, here's a simple checklist. Know your numbers. Track your blood pressure, cholesterol, and blood sugar regularly. For blood pressure, aim for under 120/80. Move daily. Even 10-minute walks 3 times a day count. The goal is 30 minutes total of movement that slightly raises your heart rate. Stay hydrated. Keep a water bottle visible as a reminder. Your urine should be light yellow. Darker means you need more fluids. Reduce salt. Most processed and restaurant foods contain more sodium than you realize. Read labels and aim for under 1/1500 milligrams daily. Recognize warning signs: fatigue, shortness of breath, upper abdominal discomfort, jaw pain, or just feeling off could be cardiac symptoms, especially if they're new or worsening. Create an action plan. Know who to call and what to do if you experience concerning symptoms. Minutes matter when it comes to heart issues. Print this list and keep it on your refrigerator as a daily reminder. Your heart works 24/7 for you. These simple steps help you protect it in return. Remember to follow up with more detailed segments on our channel where we dive deeper into each of these crucial heart protecting habits.